Motion carried. I recognize the Leader of the Opposition.
Mr. Speaker, can the Premier tell this Assembly how much is the fuel tax in Ontario and how much is the fuel tax in Saskatchewan?
Recognize the Premier.
With respect to the reduction in the fuel tax in Ontario, we went through this yesterday, Mr. Speaker, where that is saving an Ontario family about $320 over 2.5 years, Mr. Speaker. That works out to about $128 a year. That same Ontario family, Mr. Speaker, is paying more per litre for fuel in Ontario than Saskatchewan families are here in Saskatchewan. Part of that is because when they harmonized tax, Mr. Speaker, of 8% in Ontario was harmonized. Every litre of fuel in Ontario also has an 8% provincial sales tax on it. It does not in Saskatchewan, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, our proposal to suspend the provincial tax on gasoline and diesel would save the average Saskatchewan family $350 a month over that course of time, Mr. Speaker. Not nothing, and more than anything that we found in their budget. Now, Mr. Speaker, Ontario and other provinces have cut their fuel tax to give families a break at the pump. But meanwhile, Saskatchewan families are stuck paying the third highest fuel tax in the country under this tired and out-of-touch government. And more than half of Canadians at this time, Mr. Speaker, live in provinces that have cut the fuel tax to provide some relief. Why is this Premier leaving Saskatchewan people in the minority? Why is he leaving families in this province without any relief from the cost of living?
Recognize the Premier.
Saskatchewan families, I would say, Mr. Speaker, are very fortunate because there's only one province in the nation of Canada that has cut the carbon tax on their home heating fuel. Mr. Speaker, that's to the tune of about $400 a year, not $128 like the fuel tax in Ontario. That is also has the 8% PST charged on it, of which there is no PST on the fuel that we purchase in Saskatchewan, Mr. Speaker. And when you look at the affordability matrix from Regina to Toronto, Regina is ranking first, the most affordable city in the nation. Toronto is ranking 9th out of 10, Mr. Speaker, 9th out of 10. And if you're in Toronto, Mr. Speaker, in addition to paying PST on your fuel, which you don't in Saskatchewan, in addition to paying the carbon tax on your heating bill, Mr. Speaker, which you don't in Saskatchewan, you're also going to be charged a health care premium.
Recognize the Leader of the Opposition.
Mr. Speaker, I don't know. It shouldn't come to any surprise to the Premier at this point, but almost 60% of people in this province are having trouble paying for groceries, Mr. Speaker. But this tired and out-of-touch government is failing to deliver on the cost of living. And, Mr. Speaker, they are failing so badly when it comes to delivering on health care. Today, Mr. Speaker, we're joined by Shannon Orell-Bast. Shannon was diagnosed with aggressive breast cancer in August of 2022. And, Mr. Speaker, she's here today because she has faced delay after delay in getting treatment. What does the Premier have to say to Shannon and to all Saskatchewan women who've had to wait for breast cancer care in this province?
Recognize the Premier.
Mr. Speaker, I would say to Shannon and all women, some of which I know, Mr. Speaker, that are going through breast cancer treatment, that this government is entirely committed to ensuring that we are reducing not only the wait time for women to get into the screening programs that we have, Mr. Speaker, but also lowering the age so that more women can get into those screening opportunities at an earlier age, Mr. Speaker. In order to do that, we need to expand the services that are being offered. That's why you're seeing an investment, in particular in Regina, that appears to have somewhat of a longer waiting time than other areas of the province, Mr. Speaker. You're seeing that investment in a breast health care centre of excellence here in Regina, Mr. Speaker. It'll mirror what we see happening in Saskatoon in streamlining that process for screening for not only the patient, Mr. Speaker, but also for the practitioners, Mr. Speaker. I think this is an important investment. It's one that Mr. Speaker, is most certainly necessary here in the community of Regina, and I think it's a testament, in part, one of the steps in the way that this government is showing its commitment to ensuring that we are lowering those wait times in all Saskatchewan communities, and meanwhile, Mr. Speaker, also lowering the age on where women can access screening here in the province.
Recognize the Leader of the Opposition.
What it's a testament to is this government ignoring problems until it's an election year. This is their problem, Mr. Speaker. Shannon has faced barrier after barrier in trying to access breast cancer that she needs. She's had 16 rounds of chemotherapy, a double mastectomy, 25 rounds of radiation, and Mr. Speaker, she's had to fight tooth and nail to access those treatments. But she's a fighter. With 1,000 fewer mammograms being done each year, the queue of women waiting in this province for care under this tired and out-of-touch government has grown, and it's grown. Why did the Premier mismanage our healthcare system so badly that women like Shannon have to wait for months for the care that they desperately need?
Recognize the Premier.
Speaker, first and foremost, I would say that the Minister of Health would like to meet with Shannon to ensure that the path that she's taking through the healthcare system, Mr. Speaker, is as expedient as possible. Mr. Speaker, and ensure that the first opportunity that we have for whether it be mammography, whether it be for diagnostics, Mr. Speaker, is made available, because there are different wait lists in different areas of the province, and we want to ensure that we are getting those that need the services that they need as quickly as possible, Mr. Speaker. That's why, and as identified, Regina does have a slightly longer wait list. That's why you're seeing an investment in the Breast Health Centre of Excellence, Mr. Speaker. You're also seeing, in addition to that, investments in this most recent budget as well in cancer care, cancer treatment and cancer care, Mr. Speaker. Cancer treatment through the cancer centres that we have in both Regina and Saskatoon, Mr. Speaker. But also cancer research, Mr. Speaker. You saw the investment in ovarian cancer research. I had the opportunity to speak with the ladies that were down here representing Ovarian Cancer Canada, Mr. Speaker, and they were talking of the research, how they are collaborating with breast cancer research, Mr. Speaker, in genetic identification and ensuring that they are narrowing down those that may be susceptible or may be more prevalent to these particular cancers, Mr. Speaker. And I think it's important for this government to remain committed to the research, to the treatment, Mr. Speaker, and also to as early a diagnosis as we can find in this province, Mr. Speaker, as is possible. And that includes genetic testing. It includes lowering the age of our screening programs, Mr. Speaker.
Recognize the Leader of the Opposition.
Mr. Speaker, Shannon has met with the minister, and I dare say she could teach everyone in this room something about navigating the system. Let's talk about the so-called solutions that this tired and out-of-touch government has put in the window. They're sending women to Calgary at 10 times the cost for basic mammograms that should be available here in Saskatchewan. They're building a new centre here in Regina that won't be open at best until 2025. And meanwhile, for women like Shannon, for women like Lindia Kakakwe, for women all across this province, they're forced to wait months and months for care that could save their lives. How did he mismanage women's health care in this province so badly, Mr. Speaker?
Recognize the Minister of Health.
Thank you, Mr. Speaker, and I thank Shannon for being here today. We had the chance to meet, I think, on December 12th to talk about her case, and I'd be pleased to meet with Shannon here again this afternoon. Mr. Speaker, as the Premier has indicated, we take this issue very, very seriously. The investment into the Breast Health Centre of Excellence here in Regina, that is an important step. When we announced that a couple of weeks ago, we were joined by one of the surgeons here in Regina, Dr. Sarah Miller, who talked about how important that will be towards building capacity here in the city of Regina for women, not just in this city, but right across southern Saskatchewan. The surgeon talked about the importance of establishing that centre and how that will help retain and also recruit more specialists to Regina for this very critical area of healthcare for women across this province, Mr. Speaker. As part of that, there will be hirings of breast health navigators at the centre here in Regina. The budget also includes additional investment into the Saskatoon Centre, allowing them to hire more staff to help with navigation and make sure that we put our best foot forward in this, Mr. Speaker.
Recognize the member from Regina Wall Shakers.
Thank you, Mr. Speaker. Mr. Speaker, Shannon knows the healthcare system through her experience as a patient, but she also knows it as a healthcare worker. She works as a medical social worker providing support to patients. And healthcare workers like Shannon have seen the first-hand damage that this tired and out-of-touch government has done. Chronic short staffing and burnout has become the norm under this Sask Party's watch. And the minister likes to talk a lot about recruitment. But what is the minister going to do to make sure we retain the healthcare workers that we already have?
Recognize the Minister of Health.
Thank you. Thank you, Mr. Speaker. As the member will know, this government has a four-point action plan for health human resources to recruit, train, incentivize, and retain healthcare workers, Mr. Speaker, in a number of different areas, including for physicians, for nurses, for care aides, for other healthcare workers in our healthcare system, which are very valuable. And we're grateful for the work that they do. As the Minister of Health and formerly as the Minister of Rural and Remote Health, Mr. Speaker, I have the opportunity and continue to have the opportunity to meet with and visit with frontline healthcare workers in hospitals, in long-term care homes, and communities right across this province, doing so as recently as just last week, Mr. Speaker, to hear from frontline healthcare providers as to what it is that is going well for them in their facilities and in their places of work, but also where we need to help support them better. And that's why we continue to make significant multi-million-dollar investments into healthcare recruitment and retention, and will continue to do so, Mr. Speaker.
Recognize a member from Regina Walsh Acres.
Mr. Speaker, Saskatchewan people deserve so much better than those tired lines from this tired and out-of-touch government. Opening a new centre is a good thing, Mr. Speaker, but that centre won't solve problems if we don't have staff to assess patients, operate the equipment, and provide care and support. Healthcare workers know that. Shannon knows that. How come the minister doesn't know that? What's his plan to retain the healthcare staff we have left so that Saskatchewan people can get off of the wait lists and into the treatment that they so desperately need?
Recognize the Minister of Health.
Thank you, Mr. Speaker. In addition to the work being done by the Ministry of Health, the Saskatchewan Health Authority, but also the new Sask Health Recruitment Agency, they are focusing on a number of these very significant and high-priority designations in the healthcare system where we need to not only fill existing vacancies but build capacity for the future, Mr. Speaker. As indicated previously, the establishment of a breast health centre in Regina will not only help with retention but also with additional recruitment. We've heard that from the frontline healthcare providers, the significance of establishing that centre and also building capacity to the breast health centre in Saskatoon. In addition to that, Mr. Speaker, we're also working closely with other partners within the health system. For example, such as the Hospitals of Regina Foundation, which is providing fellowship funding for a couple of two Regina radiologists who are currently in other provinces, receiving their specialized training to be able to work in the area of breast health. They'll be coming back to Regina, Mr. Speaker. That's another example of partnership that's happening between the government and partners such as our health foundations to make sure that we're building capacity, Mr. Speaker.
Recognize the member from Regina Walsh Acres.
Mr. Speaker, healthcare workers like Shannon need to feel valued and respected by the Sask Party. And at every turn, this tired and out-of-touch government shuts down local voices and ignores solutions that come from the front lines. The minister still hasn't said yes to the nurses who are calling for a nursing task force. This minister needs to end the culture of fear and burnout so we can fix the crisis in retaining healthcare workers and get people in this province the care that they need. When will the minister finally deliver on that?
Recognize the Minister of Health.
Mr. Speaker, we have more healthcare providers in this province than we've ever had. More nurses, more doctors, more specialists, Mr. Speaker. He makes accusations across the way, accusations of the government or myself personally as the minister shutting down healthcare workers. That couldn't be further from the truth, Mr. Speaker. As a matter of fact, the member opposite, for once, and he was questioned yesterday by the media. What would he do? What would his plan be, Mr. Speaker? And you know what he said, Mr. Speaker? He would listen. That's all he said. He would listen. He has no plan, Mr. Speaker, and if he would ever actually put some work into this, come up with the plan, I think the people of Saskatchewan would actually like to hear that, like the plan that the government of Saskatchewan has been putting forward, a 4-point plan to hire 1,000 more healthcare workers into this province, more nurses, more doctors, more specialists, more health facilities. That's the plan of the government of Saskatchewan. We'd like to hear what the members opposite actually have to say for once.
Recognize the member from Saskatoon University.
Mr. Speaker, in addition to Shannon, we are also joined here today by Christina Dolcetti and Celeste Pinder. They came to their legislature today to advocate for timely diagnosis and treatment for endometriosis. Like Shannon, they too have faced delay after delay in accessing care for this debilitating disease. Mr. Speaker, thousands of women in our province are suffering with endometriosis, forced to step away from their careers, their education, and their ability to support their families. What is the government doing to ensure that women like Christine and Celeste no longer have to fight for treatment and access to care for endometriosis?
Here, here.
Recognize the Minister of Health.
Here. Thank you, Mr. Speaker, and thankful for the opportunity earlier today to meet with Tina and Celeste and others advocating for endometriosis patients across this province. I thank them for being here in Regina today to talk to me about what's important to them, about their personal experiences with the system, so that we can make improvements, Mr. Speaker, and make sure that we are creating a stronger pathways for those patients here in our province. Mr. Speaker, some of this, for example, is tied to the Regina Chronic Pain Clinic as an example, where in the new budget there's an additional $1.132 million for the Regina Chronic Pain Clinic to support new staff. In addition to that, Mr. Speaker, we had a very, very good discussion this morning about some of the barriers that currently exist when it comes to patients struggling with endometriosis and some paths forward. We look forward to continuing that conversation with our officials and with advocates who we have here today to form out that pathway, Mr. Speaker.
Recognize a member from Saskatoon University.
Mr. Speaker, these endometriosis patients met with the former minister last year, and yes, they met with the current minister today. Unfortunately, they didn't hear any firm commitment from that minister in ensuring that women with endometriosis no longer have to face delays in diagnosis and delays in treatment. Other provinces like Ontario, British Columbia, Nova Scotia, they have all taken this issue seriously and established a plan, Mr. Speaker. Will the minister do the right thing and commit to an endometriosis action plan today?
Here, here.
Recognize the Minister of Health.
Thank you, Mr. Speaker. What I committed to this morning in the meeting was that we would have additional follow-up. There were some questions that I had. This was my first opportunity to meet with the advocates for endometriosis Saskatchewan. We had officials from the ministry there joining us for the meeting. I had some questions that I had of our officials that we're going to follow up on, and then establish that connection back to the advocates to pursue additional action from that point in time. Mr. Speaker, as an example, we had Dr. Rattray joining us virtually for the meeting this morning. He specializes in this area. We talked about some of the challenges faced when it comes to remuneration. We'll have a discussion with the Ministry of Health about the rates when it comes to that. Mr. Speaker, I'm informed that there is training that is happening across the country, including there is a seat here in Regina where they expect a graduate a little bit later this year, and we'll be making sure that we hire that individual here into our province, so they are delivering that health care specific to endometriosis right here in our province, Mr. Speaker.
Recognize a member from Saskatoon University.
Mr. Speaker, I hope that the minister's follow-up will be swift, because failing to act has an economic impact as well. This disease impacts nearly 1 in 5 women who miss an average of 11 hours of work per week. An estimated $1.8 billion is lost annually to this disease. When this government fails to provide women's health care, they're also failing to ensure women can reach their full potential in their communities, in their careers, and in the economy, Mr. Speaker. We have not seen enough action by this government to ensure that women have access to the care they so desperately need. Will the minister today commit, in addition to following up, to creating an actual action plan for endometriosis? Yes or no?
Here, here.
Recognize the Minister of Health.
Thank you, Mr. Speaker. In addition to the items that I mentioned earlier that we discussed in the meeting this morning, I was also presented with some information from other countries, Denmark and France, for example, where they've established some strategies. I committed to the advocates that I would take a closer look at the documents that they provided, the reports that they provided to us here today, and follow up those conversations with our federal government partners as well on the potential for a national strategy. Mr. Speaker, we talked this morning about surgical management, about medical management, about clinical management as well, and again identified a number of areas where I think that we have an opportunity as a government to work closely with the advocates to identify some areas where we can make some improvements in this very important care for women in this province.
Recognize a member from Regina Elphinstone Centre.
Thank you, Mr. Speaker. It's painfully obvious that more supports are needed to go to the real priorities of Saskatchewan people. But unfortunately, this tired and out-of-touch government, instead of investing in things like women's health care, we see them wasting money on hotels connected to Sask Party MLAs. First, we learned about the Sunrise Motel, Mr. Speaker, but we need to talk a little more about the Thrift Lodge Motel. I wrote to the minister in February about this. No answer. I asked about it last week. No response, Mr. Speaker. Does he finally have a straight answer today? How much public money did his ministry pay out in the last 5 years to the Thrift Lodge Motel? The motel invested in by his office mate, the Sask Party member for Regina Northeast. Hear, hear.
Recognize the Minister of Social Services.
Hear, hear. Speaker, in terms of hotel usage, yes, we do use hotels when there's an emergency situation, similar to what the members opposite did. In terms of information asked for, there was extensive asking for information as well as information passed on to that member, Mr. Speaker, and that has been thoroughly looked at, I'm sure, by all as it was released publicly, Mr. Speaker. As a result of that, we've made some changes, Mr. Speaker. We're in the process of that in terms of policies around procurement. Mr. Speaker, again, it's the caseworkers that make those decisions, oftentimes last minute, as to when a hotel is necessary, when our shelters are full, and when there's often no other option for individuals. So we'll continue likely continue to use hotels in emergency situations. We have a new policy that we're working on, Mr. Speaker.
Good job. Recognize a member from Regina Elphinstone Centre.
So disappointing, Mr. Speaker. In addition to not answering my question, he's sort of claiming that he has answered my question. So if the minister is right about that, why not just say it here on the legislative floor? How much money did the minister pay out to the Thrift Lodge Motel over the last 5 years? Hear, hear.
Recognize the Minister of Social Services.
Speaker, in terms of direct question, I don't have that information. A lot of information was passed on to that member, Mr. Speaker, the last few months, and I'm sure she's had a chance to see that, Mr. Speaker. Again, Mr. Speaker, we've heard many questions about this, and we will continue to, in necessary situations, use hotels, Mr. Speaker. What I haven't heard from that member opposite, and I've asked her several questions about this, Mr. Speaker. She's concerned about the amount used, Mr. Speaker. We have policies in place to ensure we're trying to get the best number for the taxpayer, but also to be able to obviously have people safe when it is an emergency situation for them. But she hasn't told me what number, what dollar amount should the Ministry of Social Services and Mobile Crisis not go over for an individual. She often brings those people forward from her constituency office, Mr. Speaker. What is the dollar amount that they should not go over?
Recognize the member from Regina Elphinstone Centre.
Mr. Speaker, that minister's having a rough ride in QP, but he'd make it so much easier on himself if he just cleared the air. My God, Mr. Speaker, they share a constituency office. People deserve to have answers about this. At the Sunrise Motel, we see that payments from the minister to the hotel owned by that Sask Party MLA jumped suddenly after that owner was elected and after that minister assumed the role of Minister of Social Services. Coincidence? Perhaps. But if it walks like a duck and it talks like a duck, well, Mr. Speaker, the point is we still haven't gotten any answers about the Thrift Lodge Motel, where the Sask Party member for Regina Northeast, is an investor. How much money did the minister pay to the Thrift Lodge Hotel in the last 5 years? They have these answers. Why won't they provide them? Hear, hear.
Recognize the Minister of Social Services.
I'm not sure what the member opposite is alluding to, Mr. Speaker. I've shared constituency offices with various members over time since I've had the honour to be in government. And the reason for that is to save money for the taxpayers, Mr. Speaker. I always pass those savings from sharing office onto the taxpayer, Mr. Speaker. And so in terms of hotel procurement, Mr. Speaker, there was a lot of information passed along to that member. But what she doesn't want to answer herself, Mr. Speaker, She has a chance to say what is the dollar amount that the Ministry of Social Services and mobile caseworkers should not go over if there's an emergency situation, Mr. Speaker. What is her number? What situation would she not provide that dollar? There's people that I know, and in her constituency, there's a lot of people that come into her office. She advertises that she'll get hotels for those people, and that's great, Mr. Speaker, but she doesn't say at what point would she not provide those because it costs too much per night.
Recognize a member from Saskatoon-Uwasin.
Thank you very much, Mr. Speaker. 476 lives were lost to overdose in 2023. That's 1.3 lives lost to this crisis every single day last year. More than one family every day had to learn that their loved one was no longer with them, that their mother, father, sister, brother, or child's life was lost to this overdose crisis. This affects everyone in our province, including folks living in my constituency. Mr. Speaker, we need an evidence-based plan that will ensure that people are alive long enough to get treatment instead of continued cuts to life-saving harm reduction supports. Right. Mr. Speaker, when will the minister admit that he is wrong and commit to an evidence-based approach?
Hear, hear.
Recognize the Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. As I've said many times and will say again, every loss of life due to an overdose is a tragedy. And it is the illicit drugs, Mr. Speaker, that are resulting in those overdoses. And that's why our government is sending the message to individuals that there is no safe use of an illicit drug, Mr. Speaker. Providing individuals with an addiction the crack pipes and the instructions to use those crack pipes is not sending those individuals the right message, Mr. Speaker. Right. The message that we're sending those individuals is that there is help available through treatment. There is hope for recovery, Mr. Speaker, and we are providing more addictions treatment beds. We're making it easier for people to access those addiction treatment beds, and we're providing the supports that they need to overcome their addiction and live healthy lives in recovery. Thank you, Mr. Speaker.